likely not deficient, so we can cross out answer A. Now let's look at the common pathway. It includes factors 10, 5, 2, also known as prothrombin, and 1, which is fibrinogen. A deficiency in any of those factors would usually prolong both PT and APTT. Our patient only has a prolonged APTT, so we can eliminate answers C and D, factor 10 and factor 2. That leaves us with factor 8. Let's take a closer look at why that makes sense. Factor 8 is part of the intrinsic pathway. It works closely with factor 9 to activate factor 10 and continue the clotting cascade. If factor 8 is missing, the intrinsic pathway gets disrupted, and that prolongs the PTT. But because factor 8 isn't part of the extrinsic pathway, the PT stays normal. That's exactly what's happening in this case. These lab results point directly to a factor 8 deficiency, and there's a name for that condition: hemophilia A. Hemophilia A is one of the most well-known inherited bleeding disorders. It's X-linked recessive, which means it usually affects boys and is passed down by female carriers. Classic symptoms include bleeding into joints, easy bruising, and frequent nosebleeds. In this case, our 10-year-old patient has textbook symptoms: nosebleeds, joint swelling, and a prolonged PTT with a normal PT. That's a strong indicator of factor 8 deficiency. Diagnosing hemophilia A early lets physicians begin treatment and prevent long-term issues like chronic joint damage. Let's go over the clotting pathways one more time. Intrinsic pathway includes factors 12, 11, 9, and 8. Extrinsic pathway includes just one factor, factor 7. Thunk common pathway includes factors 10, 5, 2, also called prothrombin, and 1, or fibrinogen. PT tests the extrinsic and common pathways. PTT tests the intrinsic and common pathways. So when PT is normal and PTT is prolonged, the problem lies in the intrinsic pathway. On the exam, that almost always means a deficiency in factor 8. Let's recap the big takeaways. Normal PT and prolonged PTT? That's a sign of an intrinsic pathway defect. Have out that most common cause? Factor 8 deficiency. Diagnosis: hemophilia A. If you understand that one lab pattern, you're ready for a common ASCP exam question and for recognizing a real-world bleeding disorder.